Thank you for visiting us at the Rogers Spine Surgery Institute. I'm Dr. David Rogers. I am a fellowship-trained orthopedic spine surgeon. I specialize in treating adult patients with cervical, thoracic, and lumbar spine problems. I've been in private practice performing spine surgery for over 10 years. This is a model of the human spine, pretty close to the size of an actual human spine. We have our cervical spine, which is the neck aspect of the spine. We have the thoracic spine, which consists of the upper back and the mid back. And we have the lumbar spine, which comprises the low back. The important component is that the spinal cord exists in the cervical and the thoracic aspect of the spine. The spinal cord is extremely delicate, solid neural tissue. Spinal cord compression typically exists in the cervical spine. This is a model of the cervical spine. Just to orient, this is the anterior, the front part of the cervical spine from the side and then from the back. Again, to orient, this would be the base of the skull. And we can actually see the spinal cord in this model itself, looking through the windows of the bone, and we can see the nerve roots to the right and to the left. We also see the red structure, the vertebral artery, which carry blood up to the back aspect of the brain. Cervical spinal cord injury and compression can come from a number of causes. It can occur from a traumatic injury, such as a major car accident, a fall from 20, 30 feet. We can also get cervical spinal cord compression from a disc herniation, where a disc actually protrudes back into the spinal canal and compresses the spinal cord. We can also see cervical spinal cord compression occur from the aging process. When people get older, they will oftentimes get bone spurs. A lot of times the bone spurs are not a problem. However, there are some instances and conditions where the bone spurs actually push back into the spinal cord, or they push back into the neuroforaminal regions, is where these nerve roots come out from the side. One issue that comes up frequently in my practice is how does one treat spinal cord compression in the cervical spine? The key aspect is that most of the cervical spinal cord compression comes from the front side of the cervical spinal cord. We can address anterior cervical spinal cord compression by coming through the front of the patient's neck. This is usually very cosmetic surgery. We make transverse incisions, and oftentimes we can place them in a natural skin fold. We use plastic surgery closure techniques, so oftentimes when people undergo anterior cervical spine surgery, 6 months to a year later, it's very difficult for their friends and family to even know that they had cervical spine surgery in the first place. Myself and my staff are very friendly, we're very courteous, and we are professional. I pride myself in personalizing care to each specific patient that I treat, whether that be care with surgery or without surgery. We will oftentimes hold a preoperative spine surgery conference with the patient, their family, before the spine surgery takes place. We actually have a very large conference room, and if need be, we can bring in stadium seating. This provides the opportunity for about 45 minutes to an hour to carefully go over the problems that the patient has with regard to their spine, exactly how I'll perform the surgery, and exactly what the recovery and the rehabilitation will involve. Also, this provides an opportunity for all present to ask questions in detail about the problems that the patient is having, the surgery that the patient will undergo, and the recovery after the surgery. I also feel a tremendous sense of satisfaction in helping patients to regain function, to get their lives back, and decrease their pain. For more information, please call us at 818-243-0499 or visit us at our website, spinalcordhelp.com.